On this Sunday night, cracking down to prevent the spread of COVID-19. Nova Scotia's strict measures.
We are dealing with a deadly virus, and this behavior is unacceptable.
What the other provinces are doing and not doing to control the coronavirus. The emergency economic package.
We unveiled an $82 billion plan.
Politicians get set to vote, but is it enough? The shortage of medical equipment and the dangers facing healthcare workers.
Start doing things.
And from outer space to personal space, Chris Hadfield's guide to self-isolation.
Global National with Robin Gill.
Good evening and thank you for joining us. The Canadian government has yet to declare a national state of emergency, but every single province and territory have declared some type of health emergency. Nova Scotia is the latest, and the rules are aimed at people within the province and those from other parts of this country.
If you are coming into our province, you'll be stopped at every entry point, questioned, and told to self-isolate. For those who are not essential service and want to enter our province for social purposes, please stay home.
Our Ross Lord is in Nova Scotia. Ross, Premier Stephen McNeil was very blunt about the need for people to change their behavior.
You could hear it in his voice, and he says that he's still seeing or hearing of too many people gathering in large groups at things like beaches and parks, even street hockey games. He says they're blatantly disregarding social distancing guidelines. The new rules limit gatherings to 5 people. The government says people can still leave their homes for things like fresh air or to go out and pick up groceries, but it says families should identify one person to make the trip to minimize how many people are out in public. On top of that, effective Monday, anyone traveling into Nova Scotia from another province must also self-isolate. Exceptions will be made only for critical supplies or services. And now for a province that was late to use the word emergency, these restrictions leapfrog others.
We therefore have no choice but to call upon the police and law enforcement community to enforce self-isolation and social distancing.
All right, Ross, let's talk about the fines if Nova Scotians don't abide by these new restrictions. Lay those out for us.
Well, for individual violators, the fines will be $1,000. For businesses, $7,500. The government wanted to hammer home the point that there will be additional repeat fines if violations continue. In some ways, protecting the healthcare system here and limiting the spread of the virus is even more important in this province because we have the highest percentage of seniors in Canada and emergency departments are already overwhelmed, Robin.
All right, Ross Lord in Nova Scotia tonight. Nova Scotia isn't alone in virtually shutting down. Newfoundland and Labrador implemented penalties for people and businesses violating the social distancing rules. But what about the rest of the country? Here's Mike Armstrong now with the different measures provinces and cities are taking to combat COVID-19.
Crews are scrambling in downtown Montreal. The goal is to get this new COVID-19 testing center up and running by Monday morning. This would normally be where the city holds major festivals, but these are not normal times. Unless you go up the mountain. It felt like a fairly typical Sunday morning in Mount Royal Park, although people say they were trying to keep their distance from others.
I think it's a personal responsibility.
Now, heading out for a walk or a run is allowed, but there's a problem. When too many people head out with the same idea to the same spot, keeping that suggested 2-meter distancing is impossible. Quebec announced Sunday it is now banning social gatherings in people's homes and any social gathering outside if they're not giving that 2 meters. Police on horseback were in the park Sunday announcing those measures. The Premier is still hoping to avoid having officers enforce them.
We want to use police and the force only in very few exceptions.
Across Canada, streets that would usually be bustling even on weekends are empty. This is Regina. Even much of downtown Toronto feels like a ghost town But that's not the case everywhere. Not everyone's listening to authorities. The mayor of White Rock, BC, has been disappointed by some this weekend.
Come on, folks. Let's make it work for everybody. It's not just about you.
Every region and every province is having examples of this.
The federal health minister can impose fines, even have people jailed under the Quarantine Act. That is something she says being considered. Ottawa wants all provinces on the same page.
For me, should we see a reluctance on behalf of the country to pull together, that would be a time where we would require additional measures.
Another measure still on the table is limiting interprovincial movement, something Ottawa wants to avoid. Cabinet members say it could do more harm than help. But the Northwest Territories is now banning non-essential travel, and some provinces are ordering people to self-isolate, even if they're only arriving from another province in Canada. Mike Armstrong, Global News, Montreal.
The number of infected across Canada jumps by the day. There are now 1,400 confirmed cases in this country. The majority remain in BC and Ontario, both with 424 cases each. Quebec and Alberta are both over 200 cases. Here's how the rest of the country looks. Nearly every region in Canada now reporting confirmed cases. Only Nunavut and Yukon remain off the list. On Tuesday, the House of Commons will reconvene, but not all MPs will be there to vote on the emergency economic measures the Prime Minister announced earlier this week. Our Mike LeCouture joins us from Ottawa with what we can expect. Mike.
Well, Robin, we expect only about 20 to 30 parliamentarians to return to the House on Tuesday to pass what is being described as just the first government measure to prop up the economy and Canadians during this crisis. The $82 billion emergency stimulus package has been criticized by some as too little. It will help with wage subsidies for Canadian workers up to about 10%. Now, in Denmark, the government is providing wage subsidies of up to 75%. Both the finance minister and Prime Minister Justin Trudeau have cautioned critics that this is just the first step they are taking to support Canadians, adding there is more to come.
There is no one silver bullet. It is going to be many, many different measures brought together in the most efficient way that will help us do this.
Now, it's unclear when those other measures will be announced by the Prime Minister, but he did say they are already looking at what the next steps will be as this crisis continues to evolve. Now, one of the difficulties, though, is how to get all of that money out the door in the quickest way possible. There is no system to simply print checks for every adult in this country, but in an interview on the West Block, Foreign Affairs Minister François-Philippe Champagne said civil servants are working on getting cash in the hands of Canadians who are in the most need.
We need to find the way, the mechanism, which is fair, quick, and appropriate, because we need to have speed and resiliency in that. So we need to balance these things to make sure that what we do is fair, but also it's fast and it's resilient.
A Conservative leader, Andrew Scheer, has said his party is focused on working with the government to ensure the emergency measures help as many people across the country as possible. It's a signal of a more collaborative tone from across the political aisle as parties come together for all Canadians. Robin.
Mike LeCouture in Ottawa. And you can see the full interview with the Foreign Affairs Minister later tonight on the West Block with guest host Mike LeCouture. Healthcare workers are warning of a critical shortage of life-saving supplies. As Jeff Semple reports, one doctor in Toronto is appealing to the public for donations.
It's fast become a must-have accessory. These surgical masks donning faces across the country. But while customers are stocking up, hospitals are running out.
Every time I see someone on television wearing a mask, whether it's a surgical mask or an N95, it really makes my stomach turn.
This emergency room doctor says some supplies at his hospital could run out in less than a month. Staff have been told to conserve and not wear masks unless absolutely necessary.
We should only be routinely using protective equipment for patients who have a diagnosis or have, very, sort of concerning symptoms. And so that's where myself and quite a few of my colleagues are feeling uncomfortable.
Ontario stockpiled 55 million masks after SARS, but those have since expired, forcing hospitals to compete with the public to purchase more.
Putting a mask on someone who's sick makes perfect sense. Walking around the city wearing a mask intermittently, there's no evidence to say that that's going to help you.
The masks are required to protect both patients and healthcare workers. In Italy, nearly 10% of frontline hospital staff have been sidelined with the virus.
It's in everybody's best interest to protect us right now because at baseline, we're running at 110%.
Starting Monday, this hospital in Toronto is inviting members of the public to donate and drop off unused, unexpired protective equipment. So anything from surgical masks to protective gloves, even goggles for health officials to use on the front lines of the outbreak.
Another life-saving item in short supply, ventilators. These breathing machines for critically ill patients. This Toronto area company is in talks with the federal government to dramatically ramp up production of these portable ventilator units. But each one typically takes more than 20 hours to build.
We'll definitely be running additional shifts. And then once we understand what the demand is adding additional people as well.
The Prime Minister says Canada is ready for the anticipated spike in COVID-19 cases.
We are confident in our capacity to ramp up to provide protective equipment for frontline hospital staff and others who need it.
But many of those on the front lines don't share that optimism. Jeff Semple, Global News, Toronto.
More than 400 Canadians are now in isolation for 2 weeks after arriving back from Morocco. The group landed at Montreal's Trudeau Airport early this morning. The federal government arranged the pickup after Morocco canceled all flights in and out of the country. Canada will send 2 additional flights to Morocco this week for more stranded Canadians. The Foreign Affairs Minister also announced the feds are working on getting more repatriation flights to 7 other countries. The U.S. has reached a grim milestone. It now has the 3rd highest number of confirmed COVID-19 cases in the world. Only Italy and China have more. Over 32,000 Americans have tested positive for the virus. At least 400 have died. More than half of those deaths occurred in 2 states, New York and Washington. And those states have now been declared disaster areas. Jennifer Johnson has more on the struggles south of the border.
With the number of cases of COVID-19 rising rapidly in the U.S., 1 in 4 Americans has been ordered to stay home. And now officials in the hardest hit areas face another setback, a severe shortage of COVID-19 tests. States like New York and California have been forced to limit tests for only the most ill and healthcare workers.
If the president doesn't act, people will die who could have lived otherwise.
Early Sunday evening, U.S. President Donald Trump declared Washington state a disaster area, agreed to send the U.S. naval ships Mercy and Comfort to New York and Los Angeles, promised millions more masks, tests, and other life-saving supplies, and says he will deploy the National Guard to the 3 hardest hit states.
Our goal is to get relief to Americans as quickly as possible so that families can get by and small businesses can keep workers on the payroll.
Officials in states with the highest number of cases warn without additional supplies from the government, they'll run out by early April. Nurses and doctors fearing for their lives.
This is the first time in my career I've been a little scared for my own personal health and safety.
Businesses fearful too. Empty stores in downtown Manhattan are boarding up to prevent looters.
There's not going to be no one in the city allowed to walk around, so the city is going to be empty. So the people that are taking advantage to break into the stores.
As Rand Paul becomes the first U.S. senator to test positive for the virus, Congress is working on a $1 trillion-plus economic aid package. Lawmakers hammering out the details all weekend.
We need to get the money into the economy now. If we do that, we think we can stabilize the economy. And, I think the president has every expectation that this is going to look a lot better 4 or 8 weeks from now.
The White House hopes the president can sign the bill Monday so the government can help most Americans survive this crisis, at least economically. Jennifer Johnson, Global News, Washington.
Coming up, Croatia is hit with an earthquake. We'll show you the damage. And soldiers clamp down in Italy, in a country already ravaged by the virus. Croatia is now dealing with 2 serious crises, COVID-19 and the aftermath of a powerful earthquake. The magnitude 5.4 quake is the biggest to hit the country's capital in 140 years. Several buildings collapsed, and citizens are being warned to remain outside because of aftershocks. But they also have to maintain proper distance from each other because of the virus. In Italy, all businesses have been ordered to close until at least April 3rd. Grocery stores and pharmacies will remain open. The new measures are a desperate attempt to halt the spread of COVID-19 in the hardest hit country in Europe. There are more than 59,000 confirmed cases. In the last 24 hours, another 651 people died, pushing the country's death toll above 5,400. Australia is shutting down all non-essential services as COVID-19 cases rise rapidly in that country. Schools will stay open, but parents are allowed to keep their kids home. More than 1,300 people have tested positive for COVID-19 in Australia. At least 7 have died. COVID-19 is especially difficult for grieving families. Unlike many other events, funerals are not something you can simply postpone. But as Amanda Jelowicki reports, funeral homes are adapting.
It's probably the hardest thing a family has to experience, saying a final goodbye. While funerals normally unite families, the COVID-19 crisis is forcing them to stay far apart.
Unfortunately, we're all in the same boat. I mean, the whole world is in this situation right now, so we're just trying to figure out some ways to help our families.
Les gens de mon pays. Across the country, funeral services are adapting to the new reality of social distancing. Families are encouraged to organize funerals over the phone or internet. In Montreal, most funeral homes are restricting services to 10 to 20 people with video streaming options.
We are offering some web-based funerals in 2 of our homes, one in Laval and one on the South Shore, so that people can attend the funeral and the families can attend from a distance.
They're all practical options people are adapting to, but for grieving families, it's difficult.
When we experience mourning, it's very important to have the support of friends and family.
Some are postponing funerals for a few weeks. That isn't possible for some religions, like Islam or Judaism, where burials must happen quickly.
Out of respect for the dead, funerals are meant to be as soon as possible after somebody dies.
Sitting Shiva is a fundamental mourning process for the Jewish community. That's when friends and family visit for a week after a burial. Not being able to do that is devastating.
It's really valued, a really important practice. And so the people who aren't able to do that now, there's no question in my mind that it's a loss on top of a loss, but there's equally no question in my mind that it's the right thing to do.
Hugs, so important to funerals, are now also discouraged. Instead, it's recommended people touch hands to hearts as a symbol of love and compassion. It's the new normal in a world that is anything but. Amanda Jelowicki, Global News, Montreal.
Still ahead, a former astronaut's down-to-earth advice on social distancing. We're spending a lot of time indoors, cooped up with family, or in some cases, alone. So who better to give advice on this self-isolation than the retired commander of the International Space Station?
Start doing things. They don't have to be the things that you always did before. Take care of family, start a new project, learn to play guitar, study another language, read a book, write, create.
Chris Hadfield uploaded advice on how to cope in self-isolation onto YouTube this weekend. It's a subject he's all too familiar with, having spent 166 days in space. Up next, the good in people during a time of crisis. A crisis can bring out the best and the worst in people, and this pandemic is no exception. But we're also seeing generous acts of kindness and, in many ways, a closer sense of community. Here's Mike Drolet with some of the Canadians who are stepping up.
We're living in uncharted territory. Fear of what could happen has led to hoarding and panic, bringing out the worst in some, which prompted a family in Calgary to do some good. They put together a flyer called Neighbors Helping Neighbors, initially offering to buy groceries for seniors isolated from the world because of COVID-19. What it did is inspire others.
We have, we've got an entire army of volunteers.
The offer now is whatever anybody needs, they'll be there. And what Stephen Webb has figured out, it was never about groceries.
And it's starting to get a real good feel of, you know what, nobody's alone here. Anything that happens, we're going to go through as a group, as a community. No one's going to get through this alone.
It didn't cost them anything, yet it gave so much. The cost of giving was more acute for Ryan Cooper after St. Patrick's Day was cancelled, leaving the St. James Gate Irish pub with a fridge full of produce and a choice.
Well, yeah, it's all been given away. This is all the produce and all the stuff that was perishable.
COVID-19 may have shut his doors, but it created an opportunity to share with families fearful of going out.
So it seemed silly for it to go to waste. We wanted to do something with it. So we tried to do that.
Nashla Merheb had two goals when she moved a small shelving unit onto the sidewalk in front of her Ajax, Ontario house: help a few people and teach her kids a valuable life lesson.
I just want them to learn how to be compassionate to others, how to care for other humans. I'm all for love and caring for other people.
She's restocked twice already. Her 20 flower pots are down to one, but considering the mad rush by some to buy toilet paper, almost all the rolls she put out are still there. Two families and a pub manager living nowhere near each other, yet connected in a time of isolation by values we so desperately need. Mike Drolet, Global News, Toronto.
And that is Global National for this Sunday. I'm Robin Gill. We'll keep bringing you the latest on COVID-19, but we leave you tonight with an old song that has a new twist.
Hands, washing hands.
Neil Diamond reworked Sweet Caroline for social media, changing the lyrics to promote the importance of hand washing while fighting the virus. Thank you for watching. Have a great night.
Sweet Caroline.